Easiest way to reduce neck stiffness with a towel. Hi everyone, hope you guys are doing great so far. So now let me ask you a question today. Have you ever wake up in the morning and then having a little of stiffness in your neck that make you unable to turn your head around, feeling it got stuck, unable to move, or feeling extremely painful that's limiting you from turning or just moving your neck at all? That's a very common situation that most of us might deal with, but then it's also a very common condition that you might potentially be encountering at some point. And so today I would like to talk about two very simple exercises that you can just use a towel to do, and then whenever your neck is very stiff, especially in the morning, you can do that to make your neck move better. So now you can see I have a hand towel like this with me. For the first exercise, I'm gonna work on improving the rotation because rotation is usually the most limited movement that can happen. The way to do that will be you hold the longer side of the towel behind your neck and then you pull one side up towards your eyeball and then the opposite side down along your shoulder while you are maintaining the pull right there. You pull and then rotate your head towards the shoulder side and then come back. Pull to support the neck, turn to the shoulder side and come back. And because we do have multiple segments of the spine of the neck, you can totally move the towel to different levels. Make sure you have the firm pull, pulling down against the shoulder and then pulling along your eyeball. And then the tricky thing for this is that you have to make sure the eyeball hand is constantly pulling the towel along your face, along your eyeball. You see that my hand is following me. It's always following me. And then we're gonna do the same thing on the other side, pulling towards the shoulder to anchor and stabilize everything. The other hand pulling towards the eyeball. And then turn, make sure this hand is following my movement. Turning, following my movement. Also pay attention that I'm doing a pure rotation. There's no tilting or bending happening. It's rotating along the axis of my spine. So I'm thinking about there's a line connecting the top of my head into the ceiling all the time. So make sure you have a very long spine, a very firm grip and pull of the towel. And I would suggest to do that 15-20 reps on each side. Make sure you don't push through the painful range. Stay within the pain-free range. Repetition is key. That's the first exercise. The second exercise will be working on looking up. It's a very functional thing we need to do to look up to have a better vision, better gaze, seeing the environment around us. But then it's also a position that can really narrow the joint surface of the joints in our cervical spine. So with this exercise, with the towel pull supporting that, I can really facilitate a range of motion in a comfortable way. So the way to do that, it's very similar to the previous one. You pull the towel from both sides, pulling towards your eyeball, and then you look up into the ceiling and come back. Make sure the towel are following your eyeball and then following your movement throughout the full range. Of course, you can change to different levels. You have 7 different segments of your cervical spine in your neck. So you can totally move the towel to a different level to get through the whole range. Like I said, again, you have to make sure the exercise stay within the pain-free range. Don't push beyond your tolerance level. Again, 15 to 20 repetitions. This is a very, very gentle way to get your neck moving. I would encourage you guys, if you guys are experiencing any stiff neck situation that bothers you when you wake up in the morning, these are 2 very easy exercises to do. But then, these are very generic exercises that may or may not be specific to your condition. So, if you would like to know about what's actually happening to your neck, or maybe related to an injury or maybe to a very specific cause, and what do you need to do to address that to make your neck feel better. Definitely a physical therapy evaluation is required to further dive into the condition more. With this being said, my name is Andy Zan, physical therapist, occupational therapist, as well as a Pilates instructor at CORE Therapy and Pilates. Definitely give us a call at 512-215-4227, or you can visit us at our website therapyandpilates.com, or email us at info@therapyandpilates.com, and we would be happy to know your condition more. And if you have any questions, comment below or reach out. That's all I got for today. I hope you guys have a great day. Happy New Year. Bye.